Another hormone secreted from posterior pituitary is vasopressin. It is also known as arginine vasopressin and antidiuretic hormone. It is a peptide hormone synthesized in the supraoptic and paraventricular nuclei of hypothalamus, and it gets stored in posterior pituitary. When the stimulus occur, like increase in plasma osmolality, hypotension, hypovolemia, and dehydration, then from posterior pituitary vasopressin is released. Vasopressin acts via two receptors, either V1 receptor and V2 receptor. V1 receptor is again of V1A type and V1B type. Location of V1A receptors are on blood vessels, GIT, liver, and platelet, and V1 receptor is present in CNS, whereas V2 receptor is present on renal tubule cells, mainly in collecting duct. The function of V1A receptor is on blood vessel they cause vasoconstriction, and on GIT they cause increased peristalsis, in liver cause glycogenolysis, and in platelet cause aggregation. And in CNS, vasopressin cause release of ACTH from pituitary. V2 receptor, they are present on renal tubules in collecting duct, where they cause increase in water reabsorption and decrease in urinary output. They are also present on vascular endothelium and cause release of factor 8 and von Willebrand factor. Vasopressin acts on oxytocin receptor also, and via this receptor vasopressin causes uterus contraction. There are vasopressin analogues are present, like desmopressin. It is a selective V2 receptor agonist, and it is more potent than vasopressin as an antidiuretic. It has negligible vasoconstrictor action as it is a selective V2 agonist. It is administered by oral, nasal, and parenteral route. Next analog is livepressin. It is given by parenteral route, and it is acts on both V1 and V2 receptor. Terlipressin has selective V1 action, and it is given by IV route. Uses of vasopressin. Vasopressin acts via V1 receptor, and the action produced by acting on V1 receptor is and their use according to the V1 receptor is they stops the bleeding esophageal varices. How they stop the esophageal varices? By acting on V1 receptor, it constricts the mesenteric blood vessel and cause decreased blood flow through the portal vessels, which reduces pressure in the varices and it stops bleeding. Next, vasopressin may be used before abdominal radiography to expel the intestinal gas by acting on V1 receptor in the intestine, because it causes increased peristalsis in GIT. V2 mediated uses are they are used in central neurogenic diabetes insipidus, as they act on collecting duct and where they increase the water reabsorption and decreases the urinary output. They also used for the treatment of nocturnal enuresis or bedwetting in children. As they act on vascular endothelium and cause release of factor 8 and von Willebrand factor, so these are used for the treatment of hemophilia and von Willebrand disease. Vasopressin is also used for renal concentration test. Now, the adverse effect of vasopressin analogues are they cause nausea, vomiting, diarrhea, bulging, and abdominal cramps. Sometimes backache occur due to the uterine contraction. Vasopressin can also precipitate an attack of angina by constricting the coronary blood vessels. Hence, it is contraindicated in patients with hypertension and coronary artery disease. Intranasal administration of desmopressin may cause local irritation and ulceration. Next is the vasopressin antagonists are also present, like tolvaptan, mozavaptan, conivaptan. These are selectively V2. They have selective V2 action, means they act as an antagonist only on V2 receptor. So they are used in the treatment of syndrome of inappropriate antidiuretic hormone, that is SIADH.